Hello, this is Dr. Forrest Lanchbury from Sedona Regenerative Medicine in Cottonwood, Arizona. Today I'm presenting a guide to basic medical survival and preparedness. This guide is part of a kit that we are providing for our patients, and this kit contains several antibiotics plus some antifungal medications that can be used for several types of infections. And especially I've included antibiotics and medications that would be valuable in a pandemic or in a bioterror situation, which of course seems to be more likely with every passing day. We do have issues, of course, with our supply chain, and most of you are aware of the fact that it's difficult to get some antibiotics and other medications. And this has actually been going on since COVID. During COVID in 2020, we had severe medical supply shortages. And actually, that was carried over even into 2023, where we have supply shortages that were actually even worse in some cases than during COVID. And that seems to be going on now into 2024. And I only expect that to likely get worse given our current situation with World War III breaking out all over the place, it seems, and also with our problems in supply channels with the actual passageways being blocked in the Middle East, where we do get a lot of supplies. I'm going to just share a slide with you now just to emphasize how much of a problem this actually is. And so this is an article on healthcare supply chain shortages that as far as the hangover goes from 2020. And we actually see that in this article, it talks about up to 42% shortage in some antibiotics have been reduced by up to 42%. So it's an ongoing problem. And the other problem that we actually have is antibiotic resistance, which occurs because a lot of antibiotics are being used that aren't really necessary for infection, because they're unable to obtain the regular antibiotics, like for instance amoxicillin. And instead of using amoxicillin, we're seeing the use of really high powered antibiotics because they're available for, say, an ear infection or something. And this is occurring worldwide, possibly not as much here in the United States yet, but it is definitely a problem worldwide, and we're seeing resistance because those higher powered antibiotics are being used. And so in respect to these issues, we felt it was a good idea for people to have on hand a preparedness kit that contains many of these medications. So this booklet that I have in the kit actually explains a lot of this, and this will be contained in the kit. And there's also a booklet on antibiotic side effects in the kit, and we also have just general medication usage, a brochure on that talks about all the common infections, and we'll go over that in this presentation. So so you'll have that available in the kit if you choose to purchase one. And so let me just go ahead and share the screen here again, and we'll go over these slides. And this will, I think, be helpful for you to have. Okay, so this is a basic guide to medical preparedness and survival. There's just a little bit of a forward here with our information on the second page, and some information in general on preparedness. And a lot of times, my goal of this booklet was actually not to just be a technical booklet, but to emphasize some of the really important considerations that we have when we talk about medical preparedness and survival type situations where we're in a natural disaster. And it's obviously really important that you have good leadership, and every one of us, we all are leaders, and we just need to tap into that leadership potential. And so really one of the best things you can do to prepare for a situation where you're in a natural disaster or some other a pandemic even, where there is severe supply shortages. One of the things that can really prepare you well is just taking a leadership course. And there's a few of them out there. I mean, that can actually help you. Hardcore Leadership is one of them, and another one, Tony Robbins has a course, and there's several other ones, but they're all very helpful in any of these situations. And of course, just with in general, with just living your life well. So when we talk about basic medical survival, what are some important things to know about survival? What are the basic medical supplies I need to prepare? And so that's important to know what those are. It's also important to know a little bit about radiation sickness and how do we treat it. What are the most likely infections we need to treat when medical services are not available? And what medications are in the basic medical preparedness kit, and how do I use them? So the basic survival considerations, this is where we start talking kind of about some leadership stuff that's important to have a handle on, like just ways of living, ways of being. Really, like I said, when a lot of the stuff, the mechanics of it, and the technical aspect is easily obtainable. A lot of this, and the knowledge as far as that goes, there's a lot of books and everything that actually outline that stuff, but there isn't a lot on leadership, in these situations. And of course, when you're in the military or in some type of situation where you receive that instruction, and you have an actual squad, or you have a platoon, and I mean everything is set up in order, and it makes it easier to follow the leadership. But when you're in a civilian situation where everything is like really confused, and a lot of people don't have knowledge of good leadership, the more people that do have knowledge, the better it is. So leadership is extremely important. Learning what it means to be responsible, to have connection, contributing, authenticity, being good with your word, true to your word, commitment, and enrollment, which means basically enrollment is getting somebody to do what you want them to do, or getting yourself to do what you want yourself to do. If you don't enroll, then things aren't going to get done, right? So some of the basics, of course, you have to have hydration. Water is critical. You have to have a good water source and clean water. Nutrition, sleep, exercise are all important. And you do want to seek advice whenever possible. You should have a medical manual of some type for reference. There's quite a few out there, but one that is kind of made specifically for this, I put a link to. It's survivalmd.com, and it's a small manual, but it's actually very good for a survival situation, as far as medical survival concerns, and just survival in general. So basic survival ways of being, leadership, you're responsible, things it really helps if you will think about things being possible rather than impossible. I mean, our tendency is always to go towards the negative, but you know, it can really help with in a survival situation if you think in terms of if it's possible, it's, you know, it's me that's responsible for it being possible. If it's up to me, it's going to be, and it's 100% possible 100% of the time. If you look at the word impossible, if you just split that up and say I'm possible, yes, it is. It's about us. You know, it's about you. It's about I am possible. I live my life as if my life and the lives of others depend on me, and that's really life in general. I mean, that's the way we get to live our lives. And so connection, again, extremely important in any situation, but you know, if you look at it, illness, the word illness, if you take off the I and put a we, you know, together, wellness, it says wellness. And so it's really about working together to stay well. And, you know, that's what we do in our practice. That's what our goal is to help you heal yourself, to help the body heal itself, and for wellness to be part, you know, we're part of it, but you're the main healer. You know, your own body is the main healer. So if you can't regenerate, you know, you're in trouble. You know, you can't live if your body doesn't regenerate. So we need to help you do that, or we get to help you do that. So stay connected and work together. You know, don't be a lone wolf. If you try to go it alone, you know, go off in somewhere and try to hide. It's probably a good way to reduce your chances of survival. Actually, in the long term, disconnection is not a good idea, and you're not only not going to save yourself, but how many other lives are going to be lost because you were disconnected. And weren't able to offer your skills. So, you know, contribution, that's where that comes in. You know, you should know, your community should know what your skills are and areas where we can all contribute, and we need to be generous in our contribution as leaders. Authenticity, again, I mentioned that about being your word, because if you're not your word, then you know nobody can count on you, and you can't really count on yourself, and you don't trust yourself when you're not your word. So when you commit to something, we need, you know, we get to stay committed to it. So if I don't commit to showing up on time, then you know I pay a price, and so do others. And in a survival situation, or even if it's not a survival situation, it could lead to somebody costing somebody their life. And so we should show up as our authentic self, our true self, and this establishes trust. Commitment, every way of being has commitment as its partner. Enrollment is critical. Life is a process of enrolling others and supporting whatever it is we want, as I mentioned earlier. So support is critical to survival. So in summary, we need to stay connected, or we get to stay connected. Being responsible and true to our word and ourselves is critical to survival, and contribution and asking for support are additional critical ways of being that will increase the chance of survival. Unity through humility. If we look at Philippians 2, verses 3, 4, it says, don't be selfish, don't live to make a good impression on others. Be humble, thinking of others better than yourself. Don't think about your own affairs, but be interested in others too and what they are doing. Actually, most of this chapter is great advice on how to live our lives and not just survive, but actually thrive. Even when we're in a survival situation, it is possible to thrive. We are never an island unto ourselves. We're part of a whole. And so if we are a Christian, then we're part of Christ's body. If we're part of a loving community, when others hurt, we hurt. When we hurt, others hurt. We have a responsibility then to live out our faith. So 6 life-saving principles, and those are all listed. Above all, do no harm. Realize that the body has a lot of ability to regenerate itself, and that's an absolute requirement that regeneration occur. Doctors and medicines don't heal. Knowledge of how the body works is very important. What do you need to protect, and what kind of injuries and illness do you need to act on first to facilitate survival? Always choose the easiest and least complex solution first. Avoid contact with infected environments and avoid putting yourself in harm's way. Survival times, just a little information for you here. Body heat, if you're up to 107.6, that's definitely fatal. Cold water, 40 degrees Fahrenheit for 30 minutes max. In most people, that's going to result in death. All these are like averages. Of course, there's people that can, go beyond this in some cases that are trained specifically, have trained their bodies to do so. But with hot air, it's about 300 degrees Fahrenheit in adults. You have 10 minutes to live. Kids and small animals, even 120 degrees is max before they succumb within 10 minutes in a heated car. High altitude, 15,000 feet, usually are going to be unconscious because of the lack of oxygen. Diving depth, some have been able to free dive to 60 feet, but most will block out at about 2 minutes into that dive. Lack of oxygen, 2 minutes, people black out unless trained and can go for 11 minutes. They may be able to go that long if they're well trained, but most people 2 minutes is when they black out. Blood loss, 40% survive after spilling 30%, 15 to 30%. They're going to have lost about 750 to 1,500 mils, or about 50 ounces in an adult. So the heart rate will start to go up and breathe faster, over 20%, or 2 liters of blood loss, and they need an immediate blood transfusion. As far as eating, starvation, 45 days, you're going to lose 30% of your body weight. Usually you'll die soon at that point, but infection will probably kill you sooner than that because your immune system is so compromised. Dehydration, without water, if you don't have water, it's even sooner than 7 days probably, but you may be able to go up to 7 days, but it's probably not likely you will even get that long. It depends on, those are under ideal conditions. Radiation, 700 centigrade is fatal. 200 centigrade, you're going to have clinical symptoms. Just a little bit about dental problems, and we have that in the manual. You can read about it. There's some things that can be helpful with this. Even honey can kill a lot of undesirable bacteria in the mouth, especially like Manuka honey or some other honey that has a leptospiro. It's a type of bacteria that is in Australia that is helpful. Toothaches, if you have a toothache, it talks about the antibiotics that you may want to take. If it especially to prevent an abscess, because if the nerve is damaged and inflamed, the blood supply will be inhibited a lot of times, and eventually you can get an abscess from that. If the tooth gets knocked out, you should try to wash it and put it with salt water and put it back in. Oral cancer, green tea can actually slow the growth. Green tea is helpful for periodontal disease, and CoQ10 and other antioxidants are helpful. Calendula and echinacea kill yeast in the mouth, but fluconazole is in the kit, which can be used for that. Antioxidant, vitamins, and minerals optimize dental health. Medications to stockpile, I just listed the meds here that you may want to consider if you're on any of these medications, that you do stockpile those. And there's a link here, it's in blue, it's a little hard to see, it looks like on the slide, but in the kit you can see it. It's alldaychemist.com and sanfordpharmacy.com, and you can order medications, several different types from India there. And they're relatively inexpensive, some of them. Some that are very expensive here are not very expensive there, like Alinea or niazoxide, which is a really good broad spectrum antibiotic, antifungal, anti-parasitic. That's Alinea, A-L-I-N-I-A. And some categories of medications to consider These are all meds that some are over the counter, but things that you may want to consider having. Just a little bit about radiation sickness. Potassium iodide, if there's fallout in the area, you should take 125 milligrams immediately to help protect the thyroid. You should note the severity and time of the onset of symptoms. So after a nuclear detonation, whether it be a dirty bomb or an actual nuclear bomb or something that releases a lot of radiation, you should note, like, whenever any symptom, when that occurred, when the exposure occurred, but also when the symptoms start. And that can give you an idea about what the dose is, because if it talks about different things to look for there, but the time of vomiting post-exposure, if it's more than 4 hours, dose is most likely survival. So if it's less than 4 hours, and if you're vomiting after a nuclear attack, you may not survive, or probably won't survive. Less than 1 hour definitely won't survive. You can use Zofran to control vomiting, and it just talks about treating with different forms of chelation to get rid of the radioactive contaminants, metals like plutonium. Antibiotics, remember the immune system has to be working properly for antibiotics to work. And there's you can read through that in the manual. The emergency medicine kit contains ivermectin, azithromycin. Dosing is here. Also contains amoxicillin, trimethoprim, sulfamethoxazole, which is Bactrim, very good broad spectrum antibiotic for urinary tract infections especially, but is really effective for some skin infections, including MRSA, methicillin-resistant Staph aureus. Their augmentin could be more effective for some infections than amoxicillin, but the issue is a lot of GI side effects, including vomiting, severe diarrhea, and those type of things, which could actually make everything worse, especially in a situation where you weren't able to get IV fluids if you had severe diarrhea and got dehydrated. So I chose not to put that in the kit, and I put amoxicillin in. If you use a higher dose of amoxicillin, it can be effective against some resistant bacteria. Metronidazole or Flagyl, that's for anaerobic bacterial infections, and it's also for Giardia, which is a protozoan parasite. Fairly common, is in a lot of the water supply now in the mountains. It's in a lot of creeks and reservoirs and that type of thing. A lot of animals carry it, including beaver, and even elk have been known to carry Giardia. So that's a reason to not drink out of streams in the mountains. I mean, some people will develop resistance to this parasite, as will dogs and other animals, but they can have severe recalcitrant diarrhea for quite a while before they develop any resistance. And some older people that haven't developed resistance may never develop resistance and will need treated. Diflucan for any kind of yeast infections or fungal infections, and that's listed as far as the doses. Ondansetron is a Zofran, that's an anti-nausea medication. Also helps with migraines at times when there's nausea associated. It can be taken 4 milligrams 3 times a day as needed. Hydroxychloroquine, antiviral against coronavirus, flavivirus, retrovirus, H1N1, and H5N1 influenza virus. It's anti-inflammatory, in addition to being anti-malaria, and 200 milligrams twice a day times 7 days is the usual dose. There's a lot of actually research on that and studies on its effectiveness against different viruses. There's povidone iodine oral and nasal rinse in the kit, And this can be very helpful for viral and upper respiratory viral infections, and the directions on how to utilize that are in the kit and in this guide. Hydrogen peroxide can also be used, and usually dilute the 3% hydrogen peroxide, add 50 mils to 100 mils of water, and usually don't want to swallow it because it can make you nauseated and kind of bubble up in your stomach and give you abdominal pain in some cases. Simple COVID and other virus treatment. There's a simple treatment there, and this basically is has been and is still quite effective against COVID. Just a little bit about Ebola. Ebola, you know, there's all this belief that you can't stop this virus, but actually you can treat this. There's a lot of different things that have been shown to be effective, including fermented soy, coffee, homeopathic spider venom, vitamin C, all hold promise. IV vitamin C is probably the best for treatment of this. And ozone, IV ozone, using something like major autohemotherapy, where ozone is put into the blood after it's taken out and given back, can be quite effective also, along with UV light. And there's some links to some information on that. So I think it's important to always ask yourself this. This is what Jesus asked his disciples. He asked them if they believed. And he said, Jesus asked, do you finally believe? But the time is coming, indeed it's here now, when you will be scattered, each one going his own way and leaving me alone. Yet I am not alone, because the Father is with me. I have told you all this so that you may have peace in me here on earth. You will have many trials and sorrows, but take heart, because I have overcome the world. And I left off that was actually John chapter 16, verses 31 through 33. It is in the booklet. Okay, so that's the presentation, and hopefully you all understood that, and we do have these kits available now. I don't know how long we will. At first, we have decided to provide the first, give our patients that are already seeing us first choice on the kits, and once they've that's been available to them for about 3 to 4 weeks, then we'll leave it open to the public, as long as they're willing to schedule a short appointment to just go over their general medical history and allergies and that type of thing. So if you have any questions, you're welcome to go to our website, which is sedonaregen.com, and you can email us from there, or you can call us at 928-282-2520 and leave a message. All right, so have a great day, and thank you for watching the presentation. All right.